So without further ado, I'm really excited to share a webinar. Arya and Natalie are from the School of Population Health here at UNSW, and we funded a small project with them called Driving Change last year, and we published a report earlier on this year on the findings of that. And the notion of this is really around the use of implementation science to understand barriers to change, such as consumer behaviours, psychology, and so on. And we asked Natalie and Arya and Carolyn, who's actually on parental leave at the moment, to see if we could apply implementation science techniques to the adoption of electric vehicles, and in particular, the behaviours and perspectives and opinions around charging etiquette. Chargers are obviously, notoriously within Australia and undoubtedly the rest of the world. We are in short supply. We can't quite keep up with the EV adoption rates in terms of the charging facilities across Australia. So we have proposed that there may be a need to establish some charging etiquette in order to have a more harmonious sharing of shared resources across the country and indeed other markets as well, which we've explored. So without further ado, I'm going to hand over to Arya to share the findings of the report, which is available on our website. But there's Q&A and chat that people are more than welcome to just type in as and when, and we'll address those after Natalie and Arya have spoken through their slides. Over to you both.
Thanks so much, Sharon. Thanks everybody for joining today. Really appreciate your time. I'd also like to pay my respects to Aboriginal and Torres Strait Islanders who are present here today, and extend my respects to elders past, present and emerging. I am currently on Bidjigal land. So thanks very much, Sharon, and thanks to the Digital Grid Futures Institute for this pot of funding that I feel we have really maximised as much opportunity through to really extend the use of implementation science into attempting to translate evidence into practice, evidence into society from the perspective of the energy transition. So before I hand over to Arya, I'm going to take you through a quick journey into implementation science and just give you an idea of some of the other projects that we work on and some of our successes. And then I'll hand over to Arya, who will talk through the Driving Change project and our next steps more specifically. So jumping straight into what implementation science is and why we use it. In the health domain, which really has been the space where we have worked predominantly up until moving into different spaces such as the energy transition, we know that there is a lot of research evidence, a lot of innovations that are generated, and there is a need then to translate those successful innovations into practice to make sure that the beneficiaries really do receive the full benefits of the particular innovation. And in healthcare, this is obviously the patient. And just as an example, and there's probably very similar numbers of innovations coming out in the energy transition at the moment, but there are 491,000 clinical trials registered globally. That was as at April this year. So that is a hell of a lot of evidence to think about getting into practice when a lot of those innovations will be proven to be successful. And so implementation science is one of the ways that we can really support and speed up health system change, but then also thinking about the transition of the translation of other innovations into practice and into society. And implementation science can do this in two key ways. There's firstly implementation practice, and secondly implementation research. So implementation practice really deals with the methods and the tools that we can use to translate an innovation into a system, and this really can be undertaken by implementation practitioners, or it can be those individuals who are tasked with the challenge of implementing something within their own system or workplace or into society, or even in their own home. There might be ways that people are enacting implementation tools all of the time to help change behaviours in their own household, in a healthcare system, in a general workplace. And everybody often wants this to happen really fast. Implementation research is really how we study the application of these methods and tools to try and understand what works and what doesn't in different contexts, so that we can replicate these methods where they do lead to success, so that we can more efficiently scale up beyond one particular setting. And this is really great because it means we can replicate, we can generalize, we can help to sustain the implementation of an innovation, and we can also help to scale it up. So I'm just going to talk you through some methods as to how we do this. So one of the key things really that we focus on is stakeholder engagement. So we really want to understand from the stakeholder perspectives what their needs are, what success looks like, and how we are going to ensure that we can make meaningful engagement with our stakeholders throughout an entire implementation process, and be able to manage the success of that engagement at the kind of throughout the various stages. And depending on the size of a particular team, it may be that there are people from within a system that can support an implementation effort if we can upskill them with particular methods. Or it may be that as part of a research team, we go in and we facilitate this implementation process ourselves, and sometimes it's a mixture of the two. Process mapping is one of the key places that we start, and this is just an example in terms of a health system process, and this kind of thing can be extrapolated to any other system really, in terms of trying to understand how current practice or systems operate. And if we take this just as an example from the emergency department, we can see that we've got a particular process that is occurring. You don't need to see the writing on the screen, and there might be particular goals that need to be I guess steps that we're trying to reach and be successful in throughout each of the coloured bands. So it might be that a patient enters the emergency department, and then after triage and assessment, they're sent to various different places in the hospital. But this is really a very complex process that we often have to try and understand before we implement something new. And the other thing that we can do is try and monitor, whether it's patients or whether it's other kinds of activities in terms of behaviours that we're trying to understand, to kind of see where there might be gaps in the system, where an innovation that we're looking at might be able to support. And with this, we can also really try and understand, as well as process mapping the system and having this data to understand exactly what's going on, we can also start to understand where barriers might be occurring in the system as part of these different steps, to really try and tailor our approach to the particular gaps that are the system is experiencing. Then if we think about adding an innovation, so here we can see the innovation's been added to the top. And that means there's going to be a new practice and a process that we need to try and map and understand. And there might also be, in this case, the involvement of a GP at an earlier stage. So we really need to try and understand from the perspectives of the stakeholders, how is all of this going to work? And there might also be a navigator role or something like that within the system as well. So we need to figure out, if this is a new role, what kind of thing is this role going to do, and how is it going to help overcome some of these barriers and these gaps that we've found in the process. And throughout all of this, we're really trying to understand what success looks like. So in order for an innovation to be successful, we really need to ensure that it's implemented properly, and that might start with understanding the acceptability of the innovation. So, for example, charging electric vehicles, how acceptable is that to the audience, to the stakeholders, and as well as things that are more tangible, like the adoption, the physical adoption. Can we measure the adoption of the new innovation? And that's then going to lead to an improvement in the service. And in this instance, as I'm talking about healthcare, we're talking about outcomes for the patients, or for the electrification movement, then we'd be talking about clients, society, workplaces, etc. And so really the impact really starts with successful implementation, and we need to devise ways to measure that successfully. And throughout all of this process, we're really trying to ensure that we co-design implementation strategies that are grounded in and evidence-based, using different behavioural and system level theories and frameworks, so that we can make sure that we're tailoring the design of different strategies to the specific barriers that exist, and that align with the needs of the system and the environment that we're trying to work within. And this often takes an iterative approach, and we're always trying to really record and understand exactly what's been undertaken, so that we can replicate the things that were successful down the track. So just in terms of some successes, and again, going back to the healthcare system, we've had success in the area of patient safety, so improving the clinical and cost effectiveness of implementing a national patient safety guideline. So being able to save hospitals money and also save patient lives. We've also been able to do this in the genetics and the genomics space, where we've improved referral practices for patients at a high risk of a hereditary cancer syndrome. And then quite recently, we've used these methods to co-design a paediatric oncology medicines database to support complex care provision for children with hard to treat cancer. And you can see a snapshot of the database that we co-designed with clinicians at the bottom there. So this is our team. So we're about 20 strong at the moment, with senior researchers, research fellows, postdocs, management and professional staff, and research assistants and PhD students. And this is just the breadth of the projects that we have underway at I2I, and kind of from the past over through to the next 3 or 4 years, where we are really trying to broaden our scope of the type of projects that we work within. And a couple of key projects that we have going on at the moment, we've established earlier this year and launched the Precision Care Initiative, which is a precision oncology service within Prince of Wales Hospital. And with this, we're testing the clinical and cost effectiveness, following co-design with clinicians and patients, using some of these process mapping tools that I've described to you guys, and then also thinking about, from a research perspective, how to implement a learning health system, and how to understand how these approaches have worked well, so that we can think about how to scale up. And then another project that is a little more recent, but will take some very similar approaches from an implementation perspective, is introducing some targeted genetic sequencing approaches into the Queensland newborn screening programme. So really actually transforming the way that newborn screening is undertaken in Queensland over the next 4 to 5 years. So with that quick summary, I will hand over to Arya, and she will take you through these initial approaches that we've taken to the Driving Change project, and also some of the next steps that we plan to take with the DGFI.
Thanks, Natalie. So yeah, I guess I'll start with explaining our project Driving Change, which is basically we wanted to get a better understanding of the attitudes and behaviours behind electric vehicle charging etiquette within an Australian context. But just to give like a brief intro into why this is such a important area is that like road transport accounts for 60% of transport related greenhouse gas emissions. And without any intervention, Australia is actually projected to be one of the largest contributors to transport emissions by 2030. So this is pretty bad because when greenhouse gases are emitted into the atmosphere, they're trapped and then reflected back down, and they heat up the Earth's surface, which results in a cascade of environmental and health issues such as rising temperatures, degradation of food, water insecurity, poor air quality, pollution, the list kind of goes on. And these changes to our environment actually increase our exposure to pollutants and pathogens and poor nutrition. And these are actually risk factors for various cardiovascular, respiratory, metabolic and neurological diseases. So it's quite a long list of things of how they impact us. And as the burden of diseases increases, so does the strain on our healthcare system. So these are kind of all important reasons why we should be looking for a solution for this and trying to reduce our greenhouse gas emissions. And I guess like one promising strategy is using electric vehicles. And this is because they rely on rechargeable batteries instead of fossil fuels, and they do not produce tailpipe emissions like most internal combustion engines do. And so governments around the world, including Australia, have really pushed for the EV agenda. And while there has been an increase in electric vehicles, both on the road and by those that are being bought, there's still not enough charging stations available to support the growth. Australia has lots of plans to be made to kind of increase the networktivity of charging stations, but a lot of drivers and potential drivers have a couple issues before, wanting to purchase it and wanting to use it, and often prefer to use their own charging station opposed to a public one. And so some of the confusion is on like how to actually use the station, or anxiety of there not being enough charging station and worrying that they might not actually make it to the next charging station before running out of charge. Here's just like an example, I guess, of this is where our project comes in, Charging Etiquette, where because people aren't sure about what the rules are, there's no like universal guidelines available for them. So when we talk about charging etiquette, we refer to like a social construct on what we believe are like the socially acceptable ways to behave at a charging station. And because there isn't any one universal guidelines, a lot of people aren't sure of what is the appropriate behaviors in these situations. So a lot of different companies prioritize different rules. And because they're not always there through signage at the sites, people still aren't sure on what to do. And so I've pulled here just an example of a driving etiquette manual that's given. And they do talk a little bit about like types of charging etiquette. But again, this is not the same amount for everyone. So, for an example, one of the most popular questions we got was, when is it acceptable to unplug someone's vehicle if they've reached 100% of their charge and the driver hasn't returned? And so this is where our project comes in. So it's kind of broken down into two phases. The first phase, we did a scoping review where we kind of looked at what is working in high income countries, where they do have a well-established EV markets, because Australia is currently lagging at the moment. And we hope that we can learn from the successes and failures of other countries that are doing quite well. And then the second phase of our project was to do a qualitative interview and focus group sessions with everyday Australians and experts. And this was kind of to provide more of a better understanding of what does Australia need in order to help people feel comfortable using charging stations. And so this kind of goes back to what we've been talking about with implementation science, is we've been using these two frameworks. The one's called the Consolidated Framework of Implementation Science Research, which kind of looks at a more holistic view or an organizational approach to behavioral change. So although it might be a little bit blurry on the screen, there are different domains within the circles and the squares that are factors that can influence behavioral change. And they kind of look at it from different angles of whether it's like the individual, or it's the actual charging station, or maybe it's just like the area around the charging station. And then the other framework that we use is called the Theoretical Domains Framework, and that kind of looks at behavioral change on an individual level. So it looks at factors within the person that can help change behavior. And so just an example of like how we do this is, whether it's through a scoping review or through analyzing qualitative interview, we kind of go through the transcripts and analyze it and then code it to one of the domains or constructs in these frameworks. So on this slide, I've just pulled an example of one of the participants talking about how idle feels kind of work because people don't really want to be fined. And so we've coded it to reinforcement, which does talk about how punishment or the fear of punishment can help people engage in certain behaviors. And then we've listed strategies being, fines, penalties, idle fees, warnings, or incentives to try and help change behavior. And then we've provided a recommendation about how these things can help change people's behavior. So basically what we found using that approach is that there was a lot of mixed response towards whether we actually need a universal charging etiquette guideline. But what people really wanted is like some sort of signage where there's clear, simple, and flexible rules. And instead of focusing all of our efforts on developing a resource for all, we think that stakeholders actually might want to diversify their approach by releasing more tailored resources targeting various different demographics. And that's where we found that, some demographics preferred audio-visual resources, and they, media campaigns, social media posts, websites, videos, just like more interactive in that way. While other demographics preferred more in-person approaches, they are the type that, like to go into workshops and learn more about EVs and charging etiquette, whether it's at conference-like events or even just being able to know like who a good source of contact would be, such as like car dealers. And so when we use those frameworks that I talked about, we identified several barriers and enablers and 2 themes for advancing technology and improving communication. And we felt that these were really important to talk about. And so when I go into this next slide, which is about the challenges, it's just a very broken down, simplified version of what we show in the report. And just to highlight like a couple examples, we found that with, in the previous slide, I said innovation design. So there weren't enough charging stations and there wasn't enough variation in stations. So what this means is basically that the charging stations available were not enough, and that sometimes people weren't able to use the charging stations because they required like a different sort of plug, or it didn't match their vehicle, or the company didn't list what kind of vehicles were accepted, or they just didn't know. Another one would be like when we talk about knowledge, we talk about how if we increase the amount of knowledge, people would be more likely to engage in good charging behaviors. And so what's really cool about all of this is that we were able to put some of these recommendations into like a creative way of showcasing to other people. And we worked with this other team, Rebecca Green, and it's called Making Good Media. And basically what we did is we were able to do like this whole filming day where we talked about like some of the recommendations that we had come up with. And so in this scenario that we did, Natalie was our famous actor there. And we talked about this futuristic idea where you can actually charge your car on like a mat. And so it actually reduces waiting time. It's a standardized method to charging vehicles and it's very user friendly. So it does identify, or it does actually solve some of the barriers and enablers that we identified. And so I guess like if you want to learn more about it, more in depth, I guess, like we have our report there on the Digital Grid Futures site. But yeah, if you have any questions, like let us know. Thank you.
I'd love to ask a question to the audience, Sharon.
Yeah, go for it.
So obviously based on, kind of some of the work that we presented earlier on around the methods that we use, and obviously it was very much an example from the health system. I guess I'm just wondering whether anybody sees opportunities within their own workplace or within the innovations that they're currently developing as part of the energy transition that would, I guess kind of like to share any thoughts on that. I would really love to hear from anybody who'd like to share some thoughts.
Cool. So I've just answered a question that Laura has posted. What is meant by charging mat, or did you say map? And I've just clarified that we meant charging mat, as in a rug, a bit futuristic, but wireless charging was the concept that we were talking about. And Mark, next, given the breadth of opportunities here, what are the end goals of this particular piece of research? So Natalie just, or Arya just touched on that, Mark, where we're actually adapting or illustrating some of the findings into sort of sound bites, videos, vox pops, and so on, which will be very easily digestible bits of media. But Beck's actually on the call, so Beck, you can unmute yourself if you can. You might want to pipe in.
Yeah, sorry. What was the question, Sharon?
Oh, just I guess a bit more about the comms pieces that you're working on and the principles that you are applying. And Mark was just saying, you know, how we can extrapolate this and what the next steps are for the research and the end goals.
Yeah, exactly. Actually, Sharon, I'm unable to share screen, but I did just send you that little excerpt video that you saw at South by Southwest last week, if you want to show everyone, to give everyone a better idea. But what we're trying to do is work with this amazing research and try using what's called speculative design, which is like science fiction, to show some little future examples of everyday normal life, of what life might be like, based on some of these really interesting findings. So we're very early stages yet. We just shot this, I think it was about 3 weeks ago now, in a manic day out at Blacktown. But lots of planning has gone into it, and now lots of post-production is going to follow that.
Just in the meantime, I can speak to some of the other research opportunities. So this is a $10,000 seed grant. So, quite small in the grand scheme of big research projects. And I think a small seed grant to do the production side of things with Rebecca. But we're really seeking opportunities, whether it's in the electric vehicle space specifically, or more thinking broadly about the energy transition, as to how we can integrate implementation practice and implementation science into ensuring that we more efficiently translate some of this evidence into society.
So this video is really just, some early rushes, some early cuts that we presented this at South by Southwest last week, just to say what we're up to next. So it's by no means what the media is going to look like, but a quick sort of overview of some of the things we were talking about, like the drive over mat and so on.
Amazing, great. Nikesh, let me disable or allow your mic. There you go.
Yes, thank you. Thanks for the great presentation, everyone. So I'm the Senior Advisor for Future Mobility at the NRMA. It was wonderful to see a lot of the different avenues you went down in your research, and through our communication channels and Open Road, and through our YouTube channel, we have produced some of these assets that you speak to. But I found it very interesting, the piece that you've just shown that Rebecca was speaking to, which is, I suppose, in foresight practice, the way of showing possible futures. I think that's something we haven't explored. So that'll be, I think, something for us to look down the line next year. We run these drive days where we bring in members of public in collaboration with the New South Wales government to give them an opportunity to drive vehicles, but we also run education programs on the day. So that's where we mostly transmit this information through, but we are leveraging this information more through our social channels. Next year, we are doing a concept called NRMA in Town, where we take our community team to various regional towns to be able to disseminate this information, to make sure there's equity of information. So we use a lot of those assets, and so we'll take that research information and try to refine the work we are doing, and definitely think about ways to show possible futures. I just had a question for you. Did you draw a scale of, in terms of its effectiveness of these various ways to communicate etiquette. Was something seen as more effective by participants as opposed to the other methods?
Could I answer that, Nikesh? So before you asked your question just now, what I was going to say was I think there would be some great research opportunities with places like the NRMA where you perhaps take some of it. So we create the evidence and we have somebody like Rebecca doing these magical things to make it into something really exciting. And then there's like a ripe opportunity in the real world to measure the impact of these strategies on behaviour change or attitude change. And I think that things like that can really then strengthen the reputation of the approaches that you're taking, because it's really kind of come down this evidence generation pipeline before, I guess, kind of being released to your stakeholders or clients. And then just on top of that, in relation directly to your question, I guess with a small project like this, we've only gotten so far to kind of develop strategies. And so the next steps for us would really be to try and design some nice research studies where we can look at the impacts of single strategies to overcome particular barriers, or a multi-strategy package, depending on what it is that we want to see as an attitude or a motivation level change to engage with these new innovations, or whether it's to actually see behaviour change itself in terms of purchasing or charging etiquette behaviours changing, and be able to measure that at scale. Yeah.
No, that sounds wonderful. Natalie, I'll leave my email in the chat box, so please do feel free to reach out to me. No, that sounds like a wonderful opportunity.
Laura, what is the etiquette? Can you unplug someone else's car if it is 100%? And then Yuan has said a lot of EVs require unlocking before unplugging. Does it depend on the model?
I can answer that. So I think like that's like part of the issue, is that like people have a lot of different perspective on what they consider is good charging etiquette. When we were interviewing participants, some of them were like, yeah, it's completely fine. Someone can unplug my vehicle if they want, and if that vehicle has the capacity to do so. But other people didn't like the idea of someone just randomly unplugging their vehicle. What if they damage it in the process? Or what if they damage the plug and that person is now liable for it? So I think it really depends on the type of person and also the type of vehicle. And I guess like the point of having some sort of universal guidelines, or at least some signage at the venue, so that everyone understands like this is what we think is acceptable. If you choose to charge at this station, like these are the rules that you'll have to follow.
We've got one more. Laura, what do you find helpful in reducing charging anxiety, or is charging anxiety a rational response given the current lack of charging stations you've identified?
I can answer that again. I think that it is probably a rational response. It's with that, if you don't really know, that most EVs can actually drive a really long time before they actually need to charge their vehicle. Of course, charging anxiety is going to exist if there's not a proper network. A lot of participants did complain about, when they do more like rural routes and they're driving longer distance and there's not as frequent enough charging station, that is actually a legit concern, especially when sometimes they have gone to a charging station, the only one for hundreds of kilometers, and it's broken or there's something wrong with it. So maintenance and monitoring of it is also really important. So I think that would be one way to help alleviate it. Also, increasing the amount of charging stations would be a really helpful way as well. And, educating people and being like, sometimes people did go to a charging station and it wasn't for their car, or they didn't have the plug for that. So it's about creating some sort of standardized or universal approach that like if there's either enough charging stations for everyone, or if there aren't that many, that it can suit everyone.
And yeah, it's I think quite apt that I'm handing over to Mark now to have a very quick couple of minutes on your particular project that you wanted to explore. But you also had a personal experience with charging anxiety, and I think a couple of personal observations from my side, having had what my colleagues call a Tesla tantrum, having driven a Tesla and not having the right plug inadvertently, and having to drive a long distance to actually find a suitable site. I felt that, visibility or transparency of whether charging stations were actually available at a site I was traveling to, and or B, understanding exactly what plugs and functionality was available at those charging stations that I'm going to. I'm pretty sure it does exist somewhere, but I couldn't find it easily. And I think that speaks to the amount of education that's really needed in this space. But Mark, just knowing what an accurate range for your car would have alleviated your particular challenge. Yeah. I don't want to name and shame, but there are some car manufacturers whose range is actually overestimated, which I think is probably, yeah, the opposite of what you want.
Yeah, would thank you, Sharon. Yeah, I fully agree with what you're saying, Arya, in terms of some of those challenges regionally, and in terms of range itself, as Sharon was saying, on a trip from Sydney out to Dubbo. Wanted to plan to stop off at Yass, and was relying on the range to say, okay, yes, I've got enough charge between Goulburn, the last charging station, and Yass, and I gave myself a pretty healthy buffer. And along that route, it was the range was going down quicker than the miles that I was covering. So I was thinking at the time, because it was nighttime, if I was a single female driver, I would not be feeling very safe at that point. So certainly was certainly up to my range anxiety, and yeah, I think it's a maturing of the market and a need for more accurate range. So you can be confident if it says 120 kilometers, it isn't going to end up being more like 80.
Well, with that, I will heartily thank Natalie and Arya for sharing that. I think it's just the beginning, as we've mentioned, and I think through partnerships internally with Rebecca and the team, I think there's a real way that we can start to scale what we've done. And I think, videos and other activations and explainers, I think that Beck so talentedly, that's not a word, but I think everyone knows what I say. Really excited for the pipeline of work that we've got. So yeah, please, follow us on LinkedIn, sign up to our newsletter, and we'll make sure that we'll let you know if anything new arises. But until next time, thanks for joining, and see you next time.
Thanks, guys. Take care.
Bye.